Hello, YouTubers. Shannon Lochner's here, checking in as I've completed my third semester. So I finished my first year of the dual FNP and CNM program. Whoop whoop. So yeah, I am checking in as this was my final semester of full 12 credits. So I'm looking forward to next semester being 9 credits. Yeah, if y'all looked at my last videos, y'all know um, what life has been like. And I am outside. It's after 5. Yes, it's 5:15. And this is a lot of noise from these insects out here. So I am going to do this video in the house, or I'll check in tomorrow. Okay, came inside. It was a little noisy. Okay. Um, yes, this was my last full load in the program. This semester was 12 credits, and the last 2 semesters were 14 credits each. So yeah, I'm looking forward to 9 credits coming up in the fall. It was different. Oh, my father's calling. I guess I'll pick this up tomorrow, guys. Okay, I'm back. A few days later, but I'm back. So, like I was saying, this past semester, I had 4 classes. 2 of them are listed on, I'm looking at my computer. 2 of them are listed on my unofficial transcript so far. So for procedural skills in primary care, got an A. Woo woo. In that class, we learned suturing, we learned like injections, we used a pig, we did like soft cast and splinting. What else did we do? Did we have discussions in that one? That one was like a few lab days, but it went according to your program. So I'm nurse midwifery and family nurse practitioner. We have adult gero, we have peds. So we have acute care. So it just differs like what you'll learn. So of course ours was geared more so towards primary care. Our midwifery skills will come next year when we're doing the midwifery part. The other class that I have a grade in for was child health and wellness. That was an in-person class. Yeah, a B. I got a B plus in there. It's hard when you're doing general development, social emotional development when you already have a child or you've been around children, because you're answering the questions according to what you've been around versus what it should be. So the bright futures and the ASQ learnings, and I do that here for work already. But yeah, I had a B plus in there, so I'm cool with it. Role transition and the FNP practicum 1, those are the 2 classes that are not in yet. And but I passed. I'm sure I passed. So yay! 3 semesters down. Upcoming semester I'll have 9 credits, 3 classes, including the FNP practicum 2. We'll have special populations and also primary care again. So right now I'm preparing for the next semester. My daughter's schedule is here. My schedule is here. Clinical availability, I received an email from one of my preceptors. So I'm looking at that, trying to factor in my hours because I need 168 hours. And then the other preceptor, she didn't receive her schedule yet, so I'm just waiting. So yeah, this semester overall, I would say I had a good experience with both of my preceptors. One was the palliative care. That one was about an hour and 10 minutes away in Ohio. I'm from the Detroit area. I live in Detroit, and my drive wasn't long. I think we can get up to 2 hours to drive, but yeah, it was like an hour and 10 minutes and we did community visits there, and we also did hospital visits there. So they oversee, I think, palliative care and pain consults on the weekend for 2 hospitals in the Toledo area. So we not only did home visits, like during the week we did the home visits for patients that were already on palliative care or doing consults, and the weekend visits were more so consults or someone who may have been admitted who was already a community patient. So yeah, doing the pain consults was different, challenging for me, as I've never been privy to any of that. So the fact that it was palliative care doing it, I was like, no pain group? And she's like, nope, no pain group in this area that oversees this hospital. So that was eye-opening. But palliative care overall, I love. I could see myself doing that, not right now at this time, which was the reason why I didn't get as many hours at that location related to me becoming a recent widow. And I've just had a lot of death in my life since 2020. And I feel bad for my daughter because, yeah, I'm a grown up, I'm 38, but my daughter is a middle schooler and she's experienced a lot of death from both sides, from my side and my husband's side. And now my husband, her dad. So yeah, palliative care was that. I love palliative care. I loved it when I was an LPN at the assisted living, but yeah, not right now. But yeah, eye-opening. Love the work for sure. Love talking to the families. Love being empathetic and providing emotional support. My other rotation was primary care in a primary care office. There were 3 nurse practitioners there, 2 MDs, 1 DO, so 6 providers there. That was awesome. Your day was packed. You could see anything from Medicare wellness physicals to school physicals to sinus infections, DVTs, shortness of breath, sending people out. It just depends. But I love that people are using their primary care provider as that primary care. So I'm calling you, I'm letting you know what's going on. Can I get in today? Do you think I should go to the hospital? Do you think I should go to urgent care for this? Like, yeah. So yeah, managing care over there, I love that. I do. I love the follow through. I love the education pieces. I love coordinating plans of care with patients. So whatever their goals are, I'm happy to educate. I'm happy to give referrals. I love that part. I love that. Being trusted, being a trusted provider. There were a few patients who I was able to see for a few encounters since I was there from May. The whole summer, since I was there the whole semester. So they began to trust me once they found out I was a nurse already. So that's a misconception too. People don't know that we're nurses already. They're like, family nurse practitioner, you're a student? I'm like, yeah, been a nurse for almost 10 years though. They're like, oh, so yeah, you've seen this foot fungus, or oh yeah, you know about these bowel sounds, whatever. They're not embarrassed anymore. They're like, oh, you're a nurse, okay. So I love that. I do. The screenings, the prescribing, the ICD-10 codes, those were all new to me, new experiences. I'm glad that I did connect the dots on a lot of things and understand. But overall, I had a great experience this summer. My preceptors were very understanding of me becoming a new single mom. They were great. They provided a lot of support. Yeah, they were open to give me more information. I was able to sit in with other providers and just see, the different styles clinically of how to get things done, how to answer questions, doing motivational interviewing, all the things. So yeah, if you guys have any questions, definitely leave me some comments. Love_Shan, SHAN_ on IG. You can direct message me over there. And I don't know if I said it on my other 2 videos since we kept getting interrupted. But I've had a few people reach out from my YouTube videos, and I am happy to be a support. There are no nurses, either young or I'm not going to gatekeep or anything like that. We are a family. We are a team. We are trying to provide overall wellness to our world, literally. So I'm here. Love underscore Shan underscore. My name is Shannon, so I just cut it short. But yes, leave me some comments if you have any questions. Definitely let me know in the comments below. But yeah, thank you guys for listening, and I'm just sharing my educational journey through family nurse practitioner right now. Peace.